Good morning. Welcome to all of you to this plenary. We're surprised. I'm very, very happy and pleased and delighted that so many people being Saturday joining us today. I'd like to welcome you. My name is Josep Figueras. I work for the Observatory, and I'd like to welcome you on behalf of the Commission, who is the DG Santé, who's the organizer and the leading partner in this plenary. The title of this plenary is Safeguarding Health Together, Working Together, Unveiling the European Union's Future Health Priorities. I don't think that needs much of an introduction. Still, let me do it. Let me remind us, allow me to remind us of the very basics of why are we talking about the EU health priorities. In spite of subsidiarity, and we all know of King subsidiarity, the impact of the health union is massive. Beyond the current articles on health, the famous, infamous 168, and few others, we all know that the European Union has an enormous potential on the determinants of health. In many ways, you could say the European Union is the ideal health in all policies organization. In theory, and that's the question, how to move to the practice, from health you could influence the environment, agriculture, trade, and all those internal market elements that have such a big impact on health. So that's the first point. The second point is, how do we harness that potential? And actually, if you look at the plenaries in this year on the European Public Health Conference, in each one of these areas, the European Union plays, and could play probably, we will argue today, a far bigger role. We talk about sustainability of food systems for well-being. We talked an interesting debate on the commercial determinants, and indeed, as came out in there, the European Union can play a very big role. Health workforce, there's an element, and we'll be talking about that today, and digital, they're all areas where working together through the union, we can have a much bigger impact. But the question remains, how do we harness this potential further? And the third point, and the basics of today's debate, is we do have a window of opportunity. And many of you will say in a minute, I know that, well, the window is gone. Health is no longer the Cinderella in the Prince Ball, is back into the kitchen. And health no longer is important after COVID. So the first cliche, of course, almost a cliche, is that COVID gave us this opportunity to say that health is good for sustainability, for cohesion, for security, for growth. And as I said, maybe this window is gone already. But the second is, of course, the 2024 elections, and that famous letter that the new president of the Commission will write to the health commissioner, setting up the health priorities of the next Commission. So that's the window of opportunity, that health is now more visible, that member states are working together through this European Health Union. They understood that health is maybe a matter of public good that member states need to work together thanks to the COVID. And secondly, we have a new Commission coming. So the objective of this plenary today, this is not a plenary in actual fact, this is a public debate. So we will need you. I know many plenaries and meetings say that we want your contributions and so on, but in this case we need your contribution. The European Commission Santé as the Observatory to try to set up a number of public debates, and they use their own plenary here in EPH to use that plenary as an opportunity to hear from you about what do you think should be the key priorities of the next Commission for the European Health Union. So let me tell you the structure of what we're going to suggest, the structure for today to you. We'll have Matthias Wismar first to give us a bit of a frame of how we are organizing those debates, the kinds of priorities, themes, under which there are some priorities that we're talking about to consult, to debate. Then we'll hear from Isabel de la Mata what does she think are the expectations, the results of this process. And then Martin will take us back to the basics saying, well, why in the first place we want to do that. From the beginning, you'll have the opportunity to vote on the priorities, but then we expect you to come up through Slido to add comments as well as voting. And if at all possible, try to get, if you all agree with us, to have only 30 seconds, literally 30 seconds, because it's a big plenary, we'd like you to use the microphones and attend that. And then we'll have the panelists reacting on your points. I hope it's kind of in the right direction. As I said, it's less of a plenary talking about the strategies and future, but much more an opportunity together to begin to think what would be the priorities of this commission, and importantly as well, how we can all contribute through not only this process, which is a small process, relatively, but through our national organizations, through our politicians, our parliaments in Brussels, and so on. But Nicole, let us know a little bit. Nicole Mauer, working with us at the Observatory. Can you tell us a little bit how we're going to do the Slido and so on?
Yes, so on the housekeeping, we have set up the Slido event, and you've been to a couple of plenaries for sure by now, so you know how this works. Please scan the QR code. This will allow you to enter the Slido event. And once we've heard from Matthias, we will launch the Slido poll. And we're really looking forward to having your inputs and your votes in the poll, but also your comments and any thoughts that you have in the chat, which we will pick up throughout the session, as well as comments from the floor, as Josep said. So another important thing to note, many of you know this already as well, the Wi-Fi is not optimal in this location, so if you can use your mobile data to access the poll, that will make sure that we get as many votes as possible in. Thank you very much, and looking forward to this session.
Thank you very much, Nicole. Matthias, can you introduce us to this whole exercise? Matthias Wismar is leading the governance program with us at the Observatory, and he's written some seminal work on the role of the EU in health.
Yes, thank you so much, Josep, and we are very pleased to have so many people here in the room. As Josep says, we were tasked by the Commission with organizing a public debate, actually, and I want to introduce the topics and the limitations and opportunities, and also, of course, very briefly, the process, what are the next steps, and how can you all get involved in it. But of course, we want you to be involved in this debate already today. So, future health priorities of the EU, the themes and framework for discussion. I'll start right away with the topics, because I think this is the most important part. And the way we have discussed it was a little bit of an interaction with the European Commission, backwards and forwards, and also, of course, looking at the evidence, what is there. It's certainly not perfect, but we need to cut somehow the cake, and we came up with 9 topics. And the first one is in health security, and coming from COVID-19, I think this is not surprising, totally unsurprising, that health security is something which really on a theme which has very high importance at the moment, whether it is a virus, whether it is bioterrorism, a natural disaster, or whatsoever. I think protecting people by identifying these threats and preventing threats and working against it is clearly one theme we need to discuss. Addressing the determinants of health through health in all policies and health for all policies. Josep has just mentioned that the European Commission is actually an ideal organization to implement intersectorality. They can work together across all the different policies, and we all know how important the determinants of health are. We've been talking about very intensively the commercial determinants of health here at the plenaries and at the workshop, and I think this is certainly an area where we could discuss priorities for the future. Supporting health systems transformation. We need innovations in our health system. We need to adapt them to the social and demographic realities, and to this end we need to transform them. But how do we do this? You know, what are the tools actually? How do we overcome the barriers? And what could be the role of the European Union in this? Enhancing the labor market for health and care workers. We are in the midst of the health and care workforce crisis. We see everywhere shortages, medical deserts, skill gaps. We don't know how to fill, how to address this, and we wonder whether the European Union could actually play a role. Also bearing in mind that we have a European labor market for health workers, but very little regulation towards aligning it with health systems goals. Number 5, achieving universal health coverage. It's actually a hallmark of European health policy, but still, we have in countries population groups that are not fully covered. We have some services which are not covered in some countries, and sometimes the co-payment is prohibitively expensive. So how can we really move forward, safeguarding what has been achieved, but also completing it? 6, implementing digital solutions and artificial intelligence. I don't need to talk much about it. It's very much a topic here also in this conference. Improving the performance and resilience of health systems. I think this is what we all are striving for all the time, so what could be the role of Europe. And of course, there are some challenges which are just not going away, that are here to stay, that are here for a long time, like, for example, population aging and climate change. And greening health services, for example, is certainly a very important topic for many of us. And last but not least, it came to the forefront last year when the European Commission published its global health strategy, the impact the EU has on global health. And the question is, how can we make the most out of it? How can we support other countries in developing their health and health system? How can we mitigate negative effects coming from, for example, trade and other policy areas? Now, to have an informed debate, we have drafted briefing papers that introduce all the various topics, and you can download them. I will also give you another QR code later on. So for all the 9 topics, we briefly introduce them. It's more descriptive, but that gives us a little bit of a background. And we already started the debate, and we had quite a lively debate. We had debate at the European Health Forum Gastein with the young Gasteiners, and then in a large workshop. We had a workshop here the day before yesterday with the Commission to discuss these and have a bit of a technical debate. And the impression we have at the moment is that there is a lot of interest discussing it, and not just discussing the individual particular interest, but having more a view towards a broader policy. But there are limits to the wish list. We have great policies. Think about the One Health policy of the Pan-European Commission on the social determinants of health. Think of the SDGs. These are all unfinished agendas, policy agendas we would like to implement. And of course, while I fully believe that future health priorities of the EU can make a vital contribution to achieving those and implementing those policies, we need to take into account what the European Union actually is about. And in the first place, it's about markets. It's about the free movement of citizens, goods, services, and capital, It's not in the treaties, that it is about the SDGs, actually. It's in the first place about the markets. And one of the things I think we could achieve is a better alignment of these markets towards health and health systems. And I think that the topics we have put on the table can really make a good contribution to it. And I'm optimistic, because I can see that already quite some progress has been made. We've seen the pharmaceutical strategy, which used to be a mere industrial policy, completely indifferent towards health and health systems, and now we have something which is focusing on access and sustainability. We have the Patient Rights Directive that is really trying to make it easier for patients. We have the economic governance, which went from austerity policy to investment, actually, and of course, COVID-19 responses. There were plenty positive examples. I can go very quickly through it, but we all remember, the changes that came with COVID-19 health system responses, and these are amazing changes, both in terms of organizations, mandates, and budget. And you feel like, oh my God, the European Union has become a superpower, superheroes. They are so powerful. But in reality, the public health mandate is very limited. It's a closed gate. There's very little in the treaty which empowers us to do something about health and health system. Of course, COVID-19 with a big budget, we got the impression that so much is possible. And it's true, if there's the political will, a lot is possible. So we need to take into account that it's about markets in the first place and that the mandate is limited, and we need to see where can the health priorities really add value, not duplicating what is already happening. It's complicated, I know, but there's a lot of material, that can guide us a little bit. We have this handbook, this primer, everything you always wanted to know about European Union and health policy. We are just updating it. We have a couple of Eurohealth issues on the topic. Colleagues have produced policy briefs on it. And you find in your app a link to the Eurohealth issue where the article on the public debate is included, actually, which Nicole has actually authored. Just on the process, we are still in the beginning of the process, but we need to speed up. We kicked off the public debate in Gastein. So this is here the second event where we are talking about, and this will be followed up by webinars where we have much more opportunity to dig deeper into the technical issues, and we will most likely also have a survey and a summit workshop. And Josep is already looking a little bit concerned because he thinks, oh my God, that takes too long. But just let me sum it up. I think in this public debate, we really want to understand a little bit of a common understanding. What are the challenges? What are the opportunities? And what are the limits? And we want to have an integrated, intersectoral perspective, and not as it was in the past, the individual vested interest and silent policymaking. So that's it from my side. Thank you so much. And probably you want me to go back to the
and put the priorities, please. Yes.
Okay.
Exactly. Thank you very much. Thanks very much, Matthias.
Thank you.
The priorities.
I was there.
So, colleagues,
can you put it on?
In fact, I call it priorities, and I myself undermine myself of what I wanted to say, which is are not the priorities, these are the themes under which we're going to be building the priorities. It's no rocket science that enhancing health security should be an important theme. The question is, how further should we go? What other priorities, strategies, instruments we should be putting in place? So it's like addressing the determinants of health. Of course, this is one of the key, probably is no one to influence you, but one of the important areas that are going to come out from you today as a key area of priority. But within health in all policies and health for all policies, there are many, many instruments, strategies, approaches that are there, some already, some could be stepped up, some could be implemented better, some could be created. So these are only the themes that, and those, again, it's already constraining, and some of you will feel frustrated, so please feel free to add other priorities in your Slido, because this is the result of a process by which we've been consulting, as I said, was a key element to work in Gastein with the stakeholders there and in other places. So this is part of a process in which we hope today and then in future you are involved in trying to shape the priorities. As you can see, the European Commission themselves, it's not that you're going to use that list, I know, Isabel, but it's a background to provide to the decision makers. So Isabel, I'm going to you. Talking about that, what can we expect from this process, Isabel? What would be our wish list to get out of this process?
Well, we are now at the end of a mandate, so we are in the fifth year of this constituency of this commission, and we will have elections in June. So it's time to see what we have been doing, the good results, the bad results, or to improve results, and begin to think what we could be doing in the next period. Of course, what we could be doing in the next period will depend on the results of the election, because this, it's not rocket science work like any government. You have a new government that decides which one are the priorities. So this is why it's important now that all the different constituencies could have an opinion to where we could go, where we should go in the health area in the European Union, and which ones should be the priorities, and then the different political parties and the ones that will have to establish the policy could define themselves and could know what the citizens or the professionals of public health, the other professionals or stakeholders want for the European Union. Please remember that the European Union is not the European Commission. It's not just the European Commission. The European Union is everybody, and it's the member states and the parliament that are the ones that define the policies. But what we would like, and why we initiated this process with the European Observatory, is just that, to take stock of what we have done and to see where should we move. It's true that, as Matthias has said, that in the last 4 years, we have been doing things completely different to what we were doing before. We have been doing more things that seem impossible or complicated in the past. Now we have been doing these last 4 years since the COVID. So maybe it's time to continue this process to what we want in health: more Europe, less Europe, different Europe. What do you want that we should move in the limits, of course, of what is possible to do? Usually, when we mention the competencies or the obligation of the European Union, I insist on that, not of the European Commission, and we refer to the Article 3 of the treaty, not the one on subsidiarity, the 168, that health should be in all policies and etc. And then we also refer the Charter of Fundamental Rights, and the Article 35. And one of the things that we forget is the second part of this article that says, the Union should take into account the health in other policies and should provide health care to the citizen, etc., in the rules and with the competence of the member states. So how the different systems in the member state are established. So we need also to consider that the European Union is not only just about free movement of goods and etc., because one of the worries and one of the areas where the European Union has been working forever is in inequalities. And this is the basis for the structural fund, regional fund, the different names that have been taken over the years, so that the people in different regions, in the European Union, have the same possibilities and have a level of life that could be similar. We know that there are a lot of inequalities, but this is one important thing. We are not just worried about the transfer or the transfer of goods, merchandise, people, and etc. So, I mean, let's see. We began in collective thinking, then in Gasten, now what different professional things that should be the priorities, and at the end, I know around March or April, before the election, we could have something to present collectively to say before the elections. This is where the different stakeholders think that we should do and that we should be doing in health for the next period. And that's it. Then we have the elections, we will have a new commission, we will have a new parliament, and the new that will arrive could say, okay, this is a good idea, we need to move, and say, we don't agree with that. You say, the stakeholders say that those are the priorities, but the composition of the parliament says that we are going to do a complete different thing. Let's see.
Of course, there's a political process there. Isabel de la Mata, I haven't introduced her formally, I'm sorry. She's principal advisor to the Director General at Santé, and she has a very prestigious career behind this issue and many others. Isabel de la Mata was in the first Spanish presidency, which touched very much, together with the Belgian presidency, the issue of the role of the European Union, and has been working many years on this subject. We're not going to show yet the results of the poll. I don't know we all have had the opportunity to vote. Before that, I'm going to tell you a secret, because anyway, we're a few people here. Martin was saying to me, before starting the plenary, saying, but Josep, you know, we haven't really talked about the basics, you know. You jump into the solutions. What is the problem? Why the Commission can play, European Union can play a key role in this area. So Martin McKee, President of the European Public Health Conference Foundation, Professor on the School of Hygiene and Tropical Medicine, will tell us why the European Union is important.
Well, thanks very much, Josep. And as you say, the hat I'm wearing today is that of European public health, the European public health community, and hopefully, I don't pretend to speak for all of you here, but the fact that there are so many people coming together at our conference here to address these issues. Now, if we can just put up this slide, because what I think is really important for us to do is to have an idea of what we're trying to achieve. Now, we have got the Sustainable Development Goals. All of our governments have committed to those, but how do we make them a reality? Now, this is a figure that we put together in the Pan-European Commission report, the Monti report. And there are others. I'm not saying it's perfect, but what it does do is to try to capture the breadth of determinants of health, recognizing, and of course, because we were looking at health in the light of the pandemic, we had One Health at the middle, but humans, animals, the natural environment, the built environment, the social environment, the commercial environment right there, but also putting that, locating that on planetary health, the things we can't do anything about, like the earthquakes in Iceland today, and the things we can do something about, like global warming. And then to recognize that there are a huge number of things that we often self-exclude from because we're told that they're too political. Conflict, war, commercial determinants of health, the hostile cyber attacks as hit this country during the pandemic, disinformation, racism, corruption, all of the things that make health work that we have to engage with. And then there are all the things that make life better, many from the Ottawa Charter, but going into the modern age with access to justice, digital access, and so on. That's our basis. The European Union cannot deal with all of those, but it can deal to a greater or lesser extent to some of them. So if we have that at the back of our mind as to what we want to address, and that then takes us into this area of health for all policies, because we in the health community need other sectors to help us to get better health, but we can contribute to them achieving their goals in terms of criminal justice, in terms of transport, in terms of economic development, and all those other things. So that's where we start from. But then we recognize that the European Union can only do what the member states have allowed it to do. So in the tobacco advertising, for example, it can regulate cross-border advertising where it comes in magazines or newspapers or television, but it cannot regulate advertisements on billboards because unless they develop a life of their own, billboards do not walk across borders. So we need to recognize where those powers are. But there are lots of instruments around in other sectors. So I'm just really putting it in context to say we need to be ambitious, we need to think big, we need to get out of our lanes, out of our silos, see the big picture, and then work with the European Union, other people, the World Trade Organization, WHO, IMF, anybody that can actually help us to make things happen. But we need to have that clear vision. There, I'm sure, are better ones than this, but this was what we came up with.
Well done. Thank you very much, Martin. That was an excellent and really needed background before jumping to the solution. So what we're going to do now is to show a bit what's been your thinking. Again, repeating, these are themes. The priorities are under those themes, and we'll be talking about the priorities more specifically. And within the frame of what's possible, although I'll be arguing with you, colleagues, as you know, that maybe some people blue-eyed like me believe that it's possible to actually reform the treaty, but it's only some of us who are blue-eyed in this area. Can we see the results, please?
No.
Okay, excellent. So the first one is 61%. So as you said, we asked you, I don't think we asked them to choose three, did we? It is in the question.
They can only choose three, so.
Sorry?
They can only choose three on
So I hope you all
Slido.
exercised your right to vote and you knew you had 3 votes, not only 1. Those of you who only exercised 1 vote, I'm sorry, you'll be underrepresented in this democracy today. So really, colleagues, as we were expecting, the potential of health in all policy, health for all policy is important. In a minute, I'll be going to ask you how. Because we heard in the commercial determinant session that it's not happening as much as it should. Addressing challenges such as aging and climate change, in many ways, if you look at number 2 and number 8, is really the same idea, isn't it? Is health acting in other sectors, Martin, acting in environment, acting in other sectors have to do with these major challenges. Health coverage, of course, is important, and Under there are lots of debates, you know. Should we have a common benefit package in Europe? I know, it's not possible. I know, Isabel, let me say it anyway. You go to the European Parliament, some parliamentarians are saying we should have the same common health benefit package in Europe. People are still voting, I see. Then further down, the labor market for healthcare workers. Matthias, I will ask you a little bit about that. Improving the performance and resilience of health systems. So there's less on health systems in this particular vote. That's really, really helpful. So let's keep that in mind, Nicole, the order. Help me, because my memory is not very good, okay? And why don't you show us the results of what the small group in the workshop we had voted, of whether it's similar to this one or different. It's an interesting exercise, and how that contrasts with one of the many exercises we've been doing, but the key one, the one on Gastein, on the forum. Can you show us? Oh, excellent.
Okay. Perfect. And the thing that I found striking straight away is that even though we had a very small workshop on Thursday, we have similar results. So the determinants of health and health in and for all policies, as well as addressing challenges such as climate change and aging, have been voted as the top 2 priorities on the workshop on Thursday as well as today. So maybe we have a similar representation. Commenting on the differences between the 2 workshops that we have already held, so the one here in Dublin and the one that we had in Gastein, the interesting thing is the similarities, if we start from those. So health security, strengthening the EU's global voice, digital solutions, they haven't really received that many votes. And there might be a number of reasons for this. Perhaps these are topics that we've already dealt with extensively in the last 3 years since the pandemic, and maybe there's a bit of a feeling of fatigue of dealing with these topics, as well as maybe they are transversal. They might be useful for all of the other priorities and all of the other themes. And that might be the reason why they haven't been voted that highly. Or perhaps, I don't know, do you have an idea, Josep, why these topics might
I was
not
wondering,
be?
it's interesting that in Gastein we talked more about systems and resilience.
Yeah.
But clearly the challenges were common to both, and perhaps less on health in all policies. But it all depends. I mean, colleagues, I know what you're thinking, and I already feel I'm blushing. This is not what you call a very rigorous exercise, right? But that's an opportunity to get the opportunity to have this public debate. And more importantly, Nicole, are we getting lots of comments in the Slido, priorities? Because I want to give the priority to the audience rather than our speakers here, if we have lots of questions. Can you start looking at those?
I'll start looking,
And I'll ask my panelists now to begin to talk about those. Maybe Isabel, health determinants, health in all policies. There was a real sense the other day in the plenary, actually, I was moderating as well, about that the Commission, the European Union, because member states, I said that, you would be very proud of me, it's not the Commission only, it's what the member states pressurize and ask the Commission to do, is not doing enough in commercial determinants. It's really lots of legislation and labeling, in taxation and regulation and so on. Some, we could agree that is not within the purvey of the European Union. Some, it is. Can you comment on that? Well, how do you see that happening? And maybe I'll ask you, Martin, to comment on that, on the tools. I like to hear practicalities. I want to hear what are the strategies, the instruments, the mechanisms that we can use, and why we're not using them enough.
Okay. One of the first things I would like to comment in the results is that you can see that they are completely different depending on the audience. This is why it's so important to consult everybody and to have the view of different stakeholders. So in Gastein, there were people working more on health systems, so the priority has been health systems. Here is public health people. The first priority has been the health determinant. So as you have said, there are things that can be done and things that is more difficult to do. I will not say that it's not possible to do, because we know that maybe a lot of things that we said before that was impossible, well, now we could do. We can do legislation, but the legislation that makes sense at European Union level, and that makes sense and is related always to things that are going to cross-border. In the same way that we cannot act in outbreak of whatever, salmonella or measles or whatever in a region, in a country, because the European Union only acts when this is crossing borders, when there is in several countries, or that we cannot act in how a health system is organized. But yes, we can act when a patient is going to cross the border to go to another country, and then this is, for example, the cross-border healthcare directive. And we are acting on pharmaceuticals because they are products that are crossing borders. Well, the same is for the health determinants. We have done on tobacco. We are doing some things on alcohol. With the Europe Beating Cancer Plan, we are also working on determinants. But
in food. Food is the theme in this conference.
In food, yes, there are things that we can do. We can act in the labeling, we can act in the health claims, but we cannot oblige people to eat better, or we cannot oblige people to make exercise. And we have been doing for that. There are other mechanisms. That is the collaboration with the member state, and we have had several joint actions, so working with the member states, grants to exchange good practices. We have the expert group on public health that is trying to identify the best practices and to put at the disposition, available to make that available to other member states, and we are financing these exchanges of good practices. But, for example, acting on behaviors is very difficult for the European Union. We have been trying for a time because it's different in member states, so that is better to do at national level. And I don't know what else you would like that
I was
we
talking
could
about
try
taxation, I was talking about regulation. There have been some member states are saying that they're trying to pass regulation, for instance, from labeling in food. It's been debated beautifully in one of the sessions here. And they feel that the Commission should take the lead on that, and you have the regulatory capacity and the role, because much of this food crosses borders.
We are doing regulation on labeling. We oblige
to the front. But not strong enough, like light systems or...
But light system, we can discuss. Maybe it's not the best system. You are saying to the citizens...
I'm not suggesting a particular one. I'm saying whether there's more room to do much more of that.
There is room, and we are taking that room, and we are trying that the composition of the processed food is announced, and it's announced in a size that the people can see, and that is not
but
just
very
hidden,
small.
hidden somewhere in the back of the package. So doing the things that are possible, but saying plainly to the citizen, this is bad, this is good, you should eat that, you should, that is not which one is our role.
I want to hear from you, please. I hope we're getting lots of comments in the slide.
We are. Yeah.
Brilliant. So let me just warm up at that a little bit more, because, Martin, but let me ask you. There are also other instruments, Isabel, and I like Martin to comment on those. There are instruments around, for instance, sort of health impact assessment. Remember, Matthias, hundreds of years ago, colleagues here as well, we worked on health impact assessment. While there's no health impact assessment, there is health impact assessment. It's really minor. It's really minor compared with environmental impact assessment. What about, coordination, better steering from Santé to the directorates? I'm not challenging you, Isabel. I'm challenging the system, as you know.
I am.
Because for you, this is music to your ears, I'm sure. But let me bring Martin. This doesn't work for the Commission or for anybody.
No, because I think what we need to do is to look a little bit at ourselves. And really, the key for me here is shining a light on what's going on, transparency. Because the reality of it is, going back to labeling, if the big food producers are against something, probably we are in favor of it because it is almost certainly a good idea. But then how do we actually get to that? And I think there are a couple of things that we need to do. First of all, we need to engage with the politicians to make the arguments in ways that they understand. Now, on the Monti Commission, most of my we had hardly anybody from health. We had people from former heads of government, people from central banks and elsewhere. Why did they prioritize health? The first reason was the evidence that we and others have produced that if people's health gets left behind, if people are facing the deaths of despair, they turn to populist politics. And they are fertile ground for those who want to undermine democracy. It's not what we often think of as a reason for investing in health, but they got it. The second issue is, of course, the contribution of health to economic growth through all of the pathways. Then there are all the altruistic things, the fact that it's in the SDGs, the fact that it's in the Golden Rule, the fact that we should be doing it. But we need to get that language right. Then we really need to, yes, health impact assessment, but we also need to do much more on natural experiments, synthetic control methods and things like that, all the ways in which we can say, okay, you want to do something, well, somebody else, somewhere else in the world has done it, we will evaluate it, and then we will get the effects. So that's one. It's actually
do we need much more evidence, Martin?
No, but we need more than that.
We know what works.
We need a bit more of that, but the main thing that we need is the work that is being done on the commercial determinants of health, exemplified by the work in the tobacco industry, freedom of information legislation, looking at who is lobbying who, looking at using quantitative text analysis, all the things, analyzing the consultations. There's a lot of stuff that we can do that the people who are opposed to health are already doing. We just need to up our game. And so we need to be challenging them. We need to be much more active. And there are IFA and others, of course, I know are doing this, but with minimal resources. So I think that we have a challenge to, first of all, frame our arguments in a way that the heads of government get. The heads of government, not the health ministers, the heads of government buy into. And then
put pressure on the Commission and the European Union.
Yeah, because that's where the pressure comes from. You know, it is the big pharma, big alcohol, big tobacco, big gambling, whoever. I mean, they are working through the member states. And, you know, we've seen this in the pharma discussions, which some of us have been part of. There are some member states that are, if we talk about global health, access to medicines, there are some member states who want one set of policies, some member states that want another set of policies. So we need to get back to this point that, you know, with the best will in the world, you know, Isabel does a great job in very difficult circumstances because it is ultimately the member states that give the Commission the power that it has or deny it the power, and which then try to shape the policy.
And they're extremely smart. I remember the best party, and I'm sorry I was there, I was misled, the best party I've seen in the European Commission, in Brussels, was by the beer industry. And it wasn't just a part on the quality of the food and the beer, was the document saying the impact of the beer industry on the productivity of the economy, on the well-being, on their policies, on their staff, and so on and so forth. So it's really a well-designed one.
Can I just come in on that? Because there's a lovely one we referred to in a paper years ago. The Brewers of Europe published a paper where they said that, quote, violence is a nebulous concept. And they then went on to argue that because it is unmeasurable and so difficult to capture, that any research that links alcohol with violence in any way can be discarded. That was their argument.
Evidence-based. Evidence-based. Nicole, we promised that we get our colleagues involved on that. So I'm sure everyone agrees, but just take the more controversial ones, as you will.
I'm just going to raise all of the topics that we didn't include in the list of themes, which all of the participants are raising in the chat. So first of all, the commercial determinants, that's one that's been coming up quite a lot, as well as equity.
But hold on, let me clarify that. The commercial determinants is very much under the health in all policies element, is a sub-theme, but it should be highlighted more clearly.
What I meant to say is that people are saying it should be its own priority.
Perfect.
Equity, social and health inequalities, young people. We have, among the 9 themes, we have aging, but perhaps we need to think about how we involve young people, the next generation. We have climate change as its own priority. And a couple of people also reflecting on why some of the priorities or the themes were not ranked as high. So, for example, digital and AI, perhaps because in clinical practice, we don't know yet how that's going to look. How do we actually make use of this? As well as this is maybe more a means or a solution rather than a theme or a priority that the other priorities should then make use of to, if we want to achieve progress with healthcare workers and better working conditions, maybe digital solutions are a means to achieve that rather than the actual priority that we're looking to get to. So these are some of the comments. Maybe we can have a first round and then I'll come back.
Okay. I was wondering, Nicole, I'll ask you about the young, because you are the youngest of all of us here. By far, you lower our average. And I'll ask you in a minute about the young, but let me start, maybe Matthias, why don't you, on the environment and this concept that we've been working on and Martin has highlighted about health for all policies. What is it we can offer to the environment from health?
Well, we just had actually yesterday a workshop on the co-benefits and health for all policies, and the idea is how can we as a health sector actually contribute to the environment, to environmental targets, to climate targets. And one thing is, of course, the greening of health services. That's very clear, and it's very down-to-earth things. It's about urban planning, where do we want to have health facilities. It's about the use of fossil fuels. It's about the mobility and transport concepts, so very concrete, and we have also leading examples on this, actually. We included some in our policy briefs from Catalonia and from Toronto, but we also have discussed diet, agriculture, and all these things. If we change there for health reasons, we would at the same time
eating vegetable proteins rather than meat proteins.
Well, yes, exactly. So I think that there's plenty to do, and they are very concrete. Actually, it's not like we need a lot of research to understand what we could do, what sort of interventions would actually work. And there's increasingly, and I'm very happy to say this, on the linkage between health and other sectors, there's increasingly economic evidence also that it is a good investment, that it makes sense to invest in these areas.
On access, Martin, on access, and then I'll go back to you on the determinants, Isabel. On access, what can the European Union do in access? I mean, I was provoking by saying a common package of benefits. What can we do? We can measure access better, we can highlight it, we can name and shame, we can use cohesion funds, we can use the pillar, but what can we really do? Because that's something that, and equities is something that we all feel very strongly, but what can we do?
I think there are
from
things
the European
around.
Union.
Isabel's already mentioned pharmaceutical policy, because we've got medicines shortages all over Europe at the minute. There are issues that we can address there. In the European Commission's expert panel report, 2 reports on access to healthcare and unmet need. We need to do better at measuring that in particular, because we need to get that on the agenda. The work that WHO and the Observatory are doing in the Barcelona office, showing that people are paying a lot of money out of pocket. It's often not recognized. But
the Commission, the European Union cannot do anything about user charges.
No, they can't. But I'm
No.
talking about what the European Union can do is improve the data collection. They already collect the data in EU Silk, the survey of income and living conditions.
But shouldn't we use cohesion funds? Shouldn't we use actual funding mechanisms to ensure access? Shouldn't we allow people to cross borders to get treatment in other places?
I think we can,
much more openly than we have it now.
Before we go on to that, let me just finish with the data, because we talk about socioeconomic gaps in access. One of the things that we do not measure in Europe, and it will be very difficult to do it, because I know about the history of all of this, I mean, we recognize that, is that we are essentially blind to race and ethnicity in Europe. We need to understand the massive gaps. And we saw that in the pandemic. In the very few countries like the UK that did measure it, there was an enormous gap in access and outcomes and all the other things. In most of Europe, and we had a paper, I'm not sure if Kayvan is here and some of the others, Natasha and so on, a paper in the Lancet, one of the Lancet journals only the other day, looking at how you might move forward in that. So we need to do, European Union can do something in that area. You're quite right. Well, I think it can at least push the agenda.
I'll let you
a bit
disagree
more.
in a minute.
It's a difficult one.
Isabel.
It is difficult, but I think we need to grasp that.
But
nettle.
what instruments? I want hard
we have
instruments.
Got, of course, we've got all the structural funds, regional development funds, recognizing, as in fact European countries do, why do you have in places like Kuopio or in Maastricht such large health investments? That was governments that were investing to replace the declining industries and seeing health as a way forward. Health facilities, medical and health universities, hospitals, and so on are anchor institutions. They actually create investment. They bring investment in. You know, closing a hospital in a deprived area can be the death knell for that community. But on the other hand, by investing, you can actually support regional development, doing smart procurement, like in Lombardy, for example, where the universities and the health facilities and the local government come together to identify unmet need, all in the European Commission report on public procurement. There are lots of things that can be done there. But this is mainly about encouraging the exchange of information. Perfect. There's a limit to what you can do through legislation, but that role of making sure that good practice is identified and learned from, that's, I think, where, but you can also target some of the investment.
Isabel, I'm sorry I'm going to bring that up again. I always do that. The treaty. The treaty. The first question, there are two bands around the world, around Europe these days. One is says, unless you reform the treaty, and the movement of enlargement now may need a reform of the treaty anyway, so health can be there higher. Another say, with the tools we have at the moment, is enough. It's just the political will, the push, as Martin's been saying very effectively earlier, is using better instruments within the current treaty. But those who want the treaty are saying, because we'll get more tools, but also the thesis of Annika de Ruyter, who is publishing with you forthcoming publication, Martin, one of the many you do, is saying, is empowering health actors, because at the moment, non-health actors determine health. And there's no health committee as such. Well, it's part of other areas, but have no influence. Yeah, well, okay. Well, tell me, disagree with me, please.
What do you call the health committee? There is the health security committee, for example.
But that's health security, and I'm talking about I'm talking about commercial determinants. I'm talking about all these other areas. Do you think that we can act in other directorates with the current tools that you have, or really we need to reform the treaty? You are not asking for it. You're in public. You cannot do that.
No.
But what do you think?
We don't need to reform the treaty to impact on other DGs. If it's just in other DGs, we have other instruments, the inter-service consultation, the inter-service group. I mean, there are internal tools that we have to interact with other, not with other DGs, but to interact with other councils. I mean, at the end, we have one council. Well, we have the European Council, and we have the Council of Ministers that is setting in different formation. Well, you know that all the legislation on tobacco took a lot of time because the health people were not always in agreement with the agri people and with the taxation people, because I mean, there was an influence. It took time. We began to talk about the bad influence of tobacco on health in the 50s, and we are now 70 years later. I hope that we will not take so much time for other issues, but it takes time. But it's the discussion of everybody, not just internally in the Commission, not just internally in Brussels. It's a discussion that has to take place in all the member states.
Yeah,
and so this is maybe one of the main messages, that Brussels is not different what is the national politics. And if the Ministry of Health is not talking to the Ministry of Social Affairs and the Ministry of whatever, why do you expect that things are going to go better at European level? And I wanted to make a comment on what you say about the statistics. We are working with Eurostat currently on equality indicators, a better way to collect equality indicators. But some of the indicators are very difficult because it's forbidden in some of the European Union legislation, because, as you remember, we had World War and we have the Balkans War just because someone was labeled as belonging to a religion, to an ethnic minority, or whatever. So it's an issue that in the UK is very predominant, but in the continental Europe is more problematic. But we are trying to do that with Eurostat, and we published the report on the collection of the legal possibility of collecting information in 2017, and now we are doing an update of that to see how the situation has evolved. And we acknowledge that it's important to have the different vulnerable population, but in the same way that there is no problem for sex or other, or for age, for other is more complicated. I take the opportunity to answer different questions. There is a young strategy, contrarily to what has said, and that people say what is not yet is an elderly strategy. So this is why now people in DG Justice they are trying to do that, and we collaborate with that also in health, because I don't think that age is a problem. I think that it's an opportunity. And aging, I mean, and the elderly have not to be seen as a problem, maybe because I am arriving there. And but it's an opportunity.
We are opportunities, you and I, right, Isabel?
We are opportunities, all of us. She will be a challenge.
So let me tell you what we're going to do, because we want to finish on time. Nicole, if the population in this room we reduce by half age, perhaps not, because they're young people, but we reduce the age, what would have been the priorities, you think? Would it been the... I mean, it's one case. I'm asking you because you are young and you're on the platform, and you've been involved in these consultations with various groups. Would it be different from what we saw?
I think it would. I mean, I don't want to only say my personal opinion and be standing here and saying that I represent all young people.
Of course not. I made that point.
Maybe what I can do is report back from the workshop that we did with young people in Gastein, where the interesting finding was that none of the themes actually were the main ones. We had a lot of suggestions that were outside the framework. So.
And some were pretty radical, right?
Some were pretty radical and had to do with commercial determinants as well, like taxing, for example, some of the super profits, or taxing polluting businesses and using that to actually fund our health systems. That was one of the main ones, but also a lot of them related to climate action. So I would say...
And they wanted to put a tax on all businesses, right? A percentage to go into climate and
health. That was one
health.
suggestion, yes.
So the new voters are going to be really pushing the European Union. Colleagues, I'll ask for a quick wrap-up from you. I will start with Martin. Where do we go from here, Martin? I mean, we go home now and say, oh, well, that's the way it is. Let's try to energize each other that there are things we can do in this period, influence our parliaments, national parliaments, anyway, and European parliaments. What can we do, and particularly the European public health community? I'll ask you one topic which is very important, say a tiny bit, not as a conclusion as such, as a tiny bit on the health workforce, how much more we can do in there based on the consultation and your expertise. And then, Isabel, I'd like us to wrap up a bit of final reflections. Martin.
Well, I think you've said it, Nicole. What can you do next June? Vote. Just get out the vote. Get out the vote of young people, because those are the group that do not vote. It's the older people like me that do. I don't actually have a vote in the European Parliament. I'm hoping that before I depart this earth, I will have one, because the insanity that took place in 2016 will be reversed. But for those of you who do, just vote.
Come on, Martin, tell me a bit more. Working with Martin is always unpredictable. But tell us a tiny bit more about how we as public health community can work with constituencies, with NGOs. NGOs play a key role in this area. There's the ones... Take it. I like you do it, absolutely. Sorry about that, you should have been here.
All right, my friend, you call it a debate, and where's the debate here? Okay.
Because we ran out of time, I'm sorry.
Okay, you have to train talking less. Okay. Now, seriously, the point I wanted to make. First of all, I applaud the work you do here. The Commission has commissioned this work for a good reason, and good job on that. And yes, I wanted to make a point that if you want to call this a public debate, even remotely, you have to bring public into it. You've had a session at Gastein. I was happy to be there and to contribute. You have a wonderful session here with public health researchers and professionals. But where is the people? So what I want to say is that you need to talk with civil society, with their feet and hands on the ground. So a proposal from my side, come and talk to IFAS members. We have public health professionals, research organizations, but also patient groups, disease groups, and vulnerable population groups. So, Matthias, an offer for you. Come January, one of your workshops, do it with IFA.
And can I just come in on that? Milka, as you know I do, but I think I would go further than that. And I think one of the things that we need to do is to empower ordinary people. And a way of doing that is deliberative democracy, citizens' assemblies. It's worked here in Ireland. It's had some success in the United Kingdom. I declare an interest because my daughter works on them. But I think we need to do much more, because otherwise we are told that the silent majority is all for all the things that we know are not good. You can engage people on climate change, on the environment, on health, on all sorts of things. But we need to do it. And it's, of course, civil society organizations, but it's more than that. It's the ordinary people, a representative sample of the people. And citizens' assemblies are a way of doing that. And I just think we should have many, many more of them.
I will certainly come to do that. Thank you very much. It's a very, very, very good point. Matthias, what about the health workforce?
Well, health workforce is a very good example, but positive can happen if member states and the European Union come together. In 2010, we had council conclusion from the Belgian presidency. 2012, an action plan was started, and we all benefited from this a lot. A lot of research and action research has happened on the basis of this. And today, there's still a lot of research going on into medical deserts, in joint actions on forecasting and planning, and on
But can we
skills.
give the European
So this should be
Union more
continued.
powers?
Exactly. So there's not much in the health mandate, but we have, for example, the directive on the mutual recognition of professions. And there's now debate among some member states whether we can also actually make this much more conducive to health and health system, having an internal market for health workers that is really serving health systems. So that is something which, where I think we would have opportunities. And the baseline is, as always, some data and transparency. Do we know where the people are going, where they're ending up? You know, are they working full-time somewhere? So I think there's a lot of stuff which can actually be done.
We believe the Belgian presidency is going to take that as one of the key priorities. Sure. Isabel, you want to conclude us? Or you want to add something before Isabel? Martin?
No, everybody's leaving. We're running over time.
Okay, the last point.
No, just very short. I want to repeat what Martin said. Please vote in June. But you have seen also the results of the slides with different populations. So here there is a bubble. It's the bubble of public health, but you are not the only one. There are other people outside. So please talk to the other. Please talk to the politician. Please talk at national level. That is where we are from where we are going to have the vote, and we need to take into consideration the opinion of everybody, not just the health professional, not just the public health professional, but also not just the patients, but also the citizens. And I don't know, in many countries there is no citizens' assemblies. We maybe should establish that, but we need to know what the citizens are worried about. So we will continue this exercise.
Thank you very much indeed. From me, thanks. Sorry for talking too much. And follow the process.
Thank you very much.
Thank you.